one side of the urinary bladder. This is the vas deferens or ductus deferens. I don't care which way you put it, ductus deferens or vas deferens. Okay. Urinary bladder. This is a piece of the ureter. This right here is the seminal vesicle. Okay.
Left or right ureter?
No, don't worry about it.
Okay.
This right here is going to be the pubic bone. Okay. This is the pubic bone. Here we have the penis. This is the glans penis. This is the shaft of the penis. Okay. If you look on the other side of this model, see this right here? That's the prepuce. That's the foreskin. So on this side, you can see the foreskin. On the other side, you cannot. Okay. So you just see the glans penis. This is the corona of the penis, and again the shaft of the penis. This right here is the scrotum. That's the skin part. This right here is the testes. So blood. So as we move to the other side, let's take a look inside. This again is the urinary bladder. I ask you what's the name of the muscle right here, and call it the receiver muscle. Good. The name of the piece of muscle right here that controls the flow of urine out of the bladder is known as the internal urethral sphincter. Good. This structure right here is going to be the prostate gland. So the urinary bladder, prostate gland. The bumps inside the urinary bladder are going to be called rugae. Okay. Here's again the prostate gland. This right here is going to be the prostatic urethra. Now, next we have the membranous urethra. Well, here on either side of this urethra right here is going to be the external urethral sphincter. This area in between it, that part of the urethra in between it, is going to be known as the membranous urethra. So we have the prostatic urethra, and then in between the sticks is going to be the membranous urethra. Once we pass the membranous urethra, it becomes the what? Spongy urethra or the penile urethra. Okay? Right here, this little duct right here is going to be the ejaculatory duct. So ejaculatory duct, prostatic urethra, membranous urethra, and penile or spongy urethra. This sort of pinkish structure here and here that is on both the superior and inferior or dorsal and ventral sides of the urethra is going to be the corpus spongiosum. So if I ask you what's the name of this erectile tissue here, you say what? Corpus spongiosum. You say what's the name of the erectile tissue that's in sort of a reddish color here, you call it what? Corpus spongiosum. If I say what's the name of this erectile tissue here, you call it the what? Corpus cavernosum. Okay? The name of this structure right here in white is going to be the bulbourethral glands, also known as Cowper's glands. So it's the bulbourethral glands or the Cowper's glands. This right here is the pubic symphysis. Okay. This is a suspensory ligament. I never went over it, so I'm not going to test you on it. This is a suspensory ligament. It aids in holding the penis up. If we look inside, this structure right here is going to be the seminiferous tubules, and this structure right here is going to be the epididymis. So here's the epididymis, and right here is going to be the seminiferous tubules. Seminiferous tubules, epididymis. Okay. If I ask you what are the name of these orange dots right here, you call them the dartos muscle. If I ask you what is the name of this structure, and wouldn't know what color to call it, but maybe a brownish color, that brownish color right there, the name of that structure right there is going to be the cremaster muscle. So cremaster muscle, and then there we have the dartos muscle. Okay. Well, this yellow, I was asked about that this morning from another class. That's just adipose tissue. It's just fat. Okay. As we look on the other side, okay, this structure right up here in brown is going to be the kidney. The tube that comes down from the kidney, which we find a little piece of right here, you can always trace it back, that is going to be the ureter. This is the urinary bladder. I'm going to go through this part fast because we've already been through it on the other side. This is the detrusor muscle. The bumps are called rugae. The muscle right here on either side of this part of the bladder is going to be the internal urethral sphincter. The name of the urethra right here is the prostatic urethra. The name of the sphincter, the name of the tube right here is the ejaculatory duct. The name of this gland right here is the prostate gland. So what's the name of the structure? Prostate gland. The name of this tube right here is called the membranous urethra. The name of the structure, the name of the muscle on either side of that is going to be called the what? External urethral sphincter. External urethral sphincter. The name of this white structure right here is called Cowper's glands or bulbourethral gland. And then this tube right here is going to be called the penile or spongy urethra. The tissue on either side of that is going to be the corpus spongiosum. The structure in this bluish or purplish color is going to be the corpus cavernosum. Here we can also see the seminiferous tubules with the epididymis right here. These red dots, again, are going to represent the dartos muscle. These fibers right here in brown are going to represent the cremaster muscle. Okay. This right here is going to be the sigmoid colon. And I think, and the last one right here, which I didn't say, I'm going to put I know everybody has video cameras, so I'm trying to make this accessible to everybody. That right there is going to be the vas deferens or the ductus deferens.
Where's
Okay?
the internal urethral orifice?
Internal urethral, good question. Internal urethral orifice is right here, and the external urethral orifice is down here. Okay, everybody get that? Internal urethral orifice, external urethral orifice. Everybody get that? Okay, you can stop.